Let's now look at the potential for shunting through the atrioventricular septal defect. Note the bridging leaflets, and you see the common atrioventricular junction. Note the well-formed atrial septum, the leading edge coming down to the level of the atrioventricular junction. And note also that this heart has separate bridging leaflets. Thus, there is a common atrioventricular valve guarding the common atrioventricular junction. Here is the area of atrial shunting through the atrioventricular septal defect. The shunting occurs between the atrial aspect of the bridging leaflets and the leading edge of the atrial septum. It's this hole which we call the ostium primum defect. To demonstrate the potential for ventricular shunting, I'm going to turn the heart so that you can see its left ventricular aspect. Now the heart is turned, you can see the scooped out crest of the ventricular septum, which forms the ventricular margin of the atrioventricular septal defect. You can also see the bridging leaflets, which here in the left ventricle form part of the trifoliate left half of the common atrioventricular junction. But the bridging leaflets are floating within the septal defect, so that here, on the ventricular aspect of the superior bridging leaflet, we have the potential for shunting at ventricular level. And also here, beneath the inferior bridging leaflet, again we have the potential for shunting between the ventricles. So, when the leaflets float within the atrioventricular septal defect, there is the potential for shunting at both ventricular and at atrial levels.